Good evening, I'm Katelyn Eddington. Thanks for joining us for tonight's edition of Newswatch. The Centers for Disease Control reports around 15,000 children are diagnosed with cancer each year. And this month, cancer organizations around the world are working to raise awareness. I spoke with a pediatrician about the symptoms and diagnosis of these cancers. Dr. Brittany Odom is a pediatric physician at Sarah Bush Lincoln Health Center. She says symptoms of childhood cancer include fever, lymph node swelling, fatigue, and easy bleeding and bruising.
It can be difficult to diagnose pediatric cancer. I'll start by saying that. And the reasons why that can be a difficult diagnosis is that the symptoms are often very non-specific.
Odom says each cancer has its own treatment plan. The two most common are chemotherapy and radiation, which can be harder on children than adults.
Not only because they're a kid and they're dealing with, the mental aspect of coming to terms with I have a very serious disease, but also when you are going through cancer treatments, you're often immunocompromised.
She says open communication between parents and doctors is key during diagnosis.
When it comes to cancer, that's something that any parent will stay up night after night after night worrying about for their child. So having that communication with your doctor, with your nurses, with your staff, to be able to ask questions freely, to be able to have those conversations, and if you're nervous about something, being able to ask that question.
Dr. Douglas Graham from the Aflac Cancer and Blood Disorders Center says most children with cancer can be cured, but there's still more that can be done.
We have advances now that we're curing children, not only with better and more effective therapies, but we're doing it in a way that's less toxic and has less side effects to the patient.
Researchers say leukemia, brain tumors, and lymphoma are the most common cancers in children. Childhood Cancer Awareness Month is symbolized by a gold ribbon. A medal Dr. Odom says is both precious and strong, just like pediatric cancer patients.